Good afternoon, and thank you for the opportunity to speak. My name is Beth Maher. I come to you representing myself. I think that I represent a view that is probably a common view in all of your districts. I am not a paid social worker. I am not a client of state services, and I do not have a family member with health or human service needs. I am a member of a Presbyterian church here in Austin. About a year and a half ago, I started volunteering there in the church's weekly assistance program. We serve about 100 to 120 people. We offer things like utilities, help with utilities, rent, storage for people who have lost their homes, bus passes, IDs like driver's license and birth certificates, work boots for those who are trying to re-enter the system after being in prison, and emergency food. But we also offer hospitality, Christian fellowship, and referrals. I want to address the proposed cuts from the standpoint of small local outreach ministries. While ministries like us provide important services in the community, we also know firsthand that most people who come to us have a variety and very many needs. We already struggle to fill the gaps from inadequate state services. Maybe you know a couple somewhat like David and Sharon. They were a middle-class family. For 20 years they mowed their lawns, paid their bills, and went to work. Today they are homeless, jobless, and struggling to care for 2 grandchildren who their daughter left with them. Their new condition resulted from their daughter making the wrong decisions, having mental problems, and other circumstances that they had no control over. Sharon had a good job with the government, but she lost it because she had to miss so much work to take care of the grandchildren. A little time after that, David lost his job. Their rent went up and they lost their home. She developed diabetes and suffered partial amputation. They both now are suffering from depression. She is applying for disability, but it takes a long time. She did get a job at Walmart, but she stands on her feet with this amputation all day long. He has not found any steady work. They and their 2 grandchildren are living now in a faith-based program called Interfaith Hospitality Network that opens churches, and they can stay there for up to 3 months to try to find work. Another nonprofit is looking for them a small house to rent. The agency will pay rent for the year. I hope you see from this story the cascading needs that push families from self-sufficiency to neediness and the web of assistance required to help them. It takes the coordinated efforts of state programs and the nonprofit community working to get a family like David and Sharon back on their feet. We are interconnected in our efforts to help. I would ask you to consider the impact that your budget decisions will have on the demand for services from faith and community-based groups. Please be deliberate in improving the coordination of our efforts so that Texans don't fall through the cracks.
Thank you, Ms. Maher.